All right. Hello, everybody. Thank you for joining the webinar from us here at Lettuce, Healthcare Unlocked for Solos. We will have time for Q&A at the end. So if you have any questions, feel free to put them in the chat, or you can use the Q&A functionality of Zoom too. I got both of them open. But yeah, just hang tight and we'll get through the webinar first, and then we'll answer your individual questions. And we can also have a little chat if you want to get on on the Zoom and actually talk too. So, all right, let's get started. So I am Mark Jackson. I am the head of member benefits here at Lettuce. I, like you guys, have been a fractional freelancer, a solo. I've done it for over 10 plus years throughout my career. And my dad was actually a business of one as well. And I watched him struggle with the same things that I struggle with, which was taxes, access to benefits, handling all the admin, all that good stuff. But for me personally, my wife's a kidney transplant patient, and my buddy and I actually started a company called Be Solo, and it was actually purchased by Lettuce at the end of 2025, and we'd figured out how to utilize what's called PEO to give group benefits to solopreneurs because that was like a brick wall for me, right? It was to how can I recreate the benefits access that I had as an employer, because going through the marketplace scenario and looking at independent plans is pretty scary or crazy expensive. So I'm excited to be here and try to be part of the solution to make kind of the solopreneurial life as sustainable as you want it to be, right? I think that's one of the big things that always comes to mind for me is this idea of churn back to W-2 where you're kind of forced to leave the solopreneurial lifestyle out of something out of your control. And when it comes to, health, that's one of the big things that can really push people to leave this lifestyle. So that's what it's all about for us here at Lettuce is this career and lifestyle freedom. And it's honestly kind of ridiculous, kind of the compromises we have to face entering the solopreneurial lifestyle. And at a high level, it is broken in multiple ways, not just benefits access. And it's no longer a niche market. Almost 40% of the whole US workforce freelanced. That includes self-employed work, or gig work and all that. So anybody that has done any type of self-employed work, almost 40% of the US workforce did so last year. And out of that percentage, out of that chunk of folks, 34% want a better tax strategy because quite honestly, once you start understanding things like self-employment tax, it can be quite painful financially to be running as an LLC or a sole proprietor. And you want to kind of figure out how to maximize those savings beyond just writing things off. And S-Corp tends to be one of those common threads. And we're going to talk about S-Corp a lot today because it's actually connected how we unlock true group benefits with the S-Corp functionality actually is needed. And only 4% of self-employed people are taking advantage of the savings S-Corp can drive today. And then this last one is pretty terrifying. About one out of four people who are self-employed just don't even have health insurance, and some just choose to do that. And in today's age, that can be pretty scary because the health related expenses are the second highest driver of household bankruptcy in the country today. My wife's kidney transplant ended up being $1.7 million all said and done, which is pretty crazy. So to think about facing those types of expenses without insurance is pretty scary stuff. So what is Lettuce, right? Lettuce is, I think it's worth kind of framing what it is we're trying to do here. Think about it as the solo HQ, right? For all of this stuff, these operational things that you don't really want to have to deal with when you make the choice to be in this lifestyle and this career, but really need to get dealt with, or they kind of end up being one of those churn drivers that can be like, you just kind of throw your hands up in the air. You're like, I don't want to do this anymore, right? And I'm proud to say that Lettuce is kind of taking over some of the most annoying ones that we all have to deal with, right? Taxes, Payroll for the S-Corp folks. You actually have to run a payroll for yourself in order to see the tax savings that you get out of S-Corp. The bookkeeping piece, you actually do need accounting and the compliance and expense tracking and all that good stuff to operate as an S-Corp as well. We also have a nice little invoicing tool in there so you can consolidate invoicing right into the platform. And we also have benefits access. We have group rate healthcare. We actually have business insurance. We just acquired a company called Carry. So we now have a solo 401k offering that is owned by Lettuce. And we will be adding dental and vision and potentially accident and hopefully in the very near future. But we'll talk about more of that. We'll talk about that more in a second. So today, what we're going to go through at a very high level is how do you gain access to group benefits, right? And I keep saying this word group benefits because that's what employers used. And the benefit of group benefits is that, you get a group that's large enough and all of a sudden you can drive rates down, right? Because risk as a whole gets less as the group gets larger. Granted, the ACA and marketplace, the Affordable Care Act marketplaces that are happening in the States are kind of the antithesis to that because in that scenario, the group has gotten too large and the costs are going through the roof. But, employers typically use group rate benefits to say, hey, I've got this group of folks, and we can go talk to carriers for that group. So I'm gonna tell you how that's done, and we do it through what's called PEO. Just remember those letters. We'll talk about them in a second, and we'll talk about the benefits we have available, what the enrollment process is like, and then we'll have time for a Q&A. So the dilemma, right? We don't know this is happening for a lot of us as we exit a W-2 job, right? What I like to think of a W-2 job is like a walled city, right? And somebody else is handling power, somebody else is handling electric, somebody else is handling water, somebody else is handling taxes, payroll, all this stuff. When you become a solopreneur, you kind of step out into this kind of great unknown, or like a jungle or something like that. And you're kind of going on this adventure. And depending on which paths you choose, it can be really beautiful and freedom kind of and inspire a lot of freedom, or it can be really kind of tumultuous. And one of the biggest kind of dilemmas is that when you leave that walled city of W-2 work, you are now an individual and you are limited to kind of what individual benefits are available on the marketplaces or through independent plans, or you can potentially join an association, but you have to be eligible, all this kind of stuff. And you lose, but for the most people, you lose group benefits access, and all of a sudden the rates and the coverage rates get higher and the coverage gets potentially worse. What's interesting is every business has basic HR responsibilities, even a little itty bitty business of one. All right. There's payroll and tax withholdings. When you sign yourself up for payroll as an S Corp, you actually are supposed to report to the state that I'm starting as a hire of my own company. Some companies need workman's comp. And then if you think about this from a company perspective, our businesses of one need benefit sourcing and administration. Well, what's interesting is these HR responsibilities can be contracted out just like any other service offering in a business. And we do so through what's called PEO, which is a really interesting consolidation mechanism for HR responsibilities. The PEO or professional employer organization takes the kind of service of a business to a kind of new level, which is you're actually going to get hired by the PEO entity or company, if that's a more familiar term for you, right? And that's why it's called an employer organization. So basically, you are, along with the employees of lots of other companies, technically running payroll for yourself underneath the PEO's EIN or federal identification number. And now all of a sudden, this is a group mechanism that carriers, meaning kind of insurance providers, recognize and say, okay, yeah, that's a true group. And there's also all these laws behind the scenes that are really important, things like ERISA or you don't need to know about, right? Because they're super kind of boring and crazy. But the long story short is that the PEO allows employees from lots of different companies to, on paper, run their payroll for themselves or for their employees underneath this third party company. And now we created a group. And you're like, that sounds crazy, right? It's so weird, right? But it's actually super, super common. There's over 200,000 businesses that use PEO today. And if you've ever been in a company that's around, typically the sweet spot for PEOs is around 10 to 500 employees. You've probably been under a PEO and not even known it. You might have noticed that your paycheck has a different name on it. But there's huge companies that do this, companies like ADP, Rippling, JustWorks, Deal. And my journey onto why I was able to figure out how to do this for solopreneurs was I was number four at a company called Velocity Global, which is now called Pebble, which is one of the biggest international PEOs in existence. So I just took what I learned there and applied it to the solopreneurial space. But what we realized is PEO does not work for all solopreneurs, right? The mechanism of grouping is payroll. And in a sole proprietor or LLC scenario, kind of the more standard issue, how I run my business as a solopreneur structures or a fractional or whatever you are, right? You don't run a payroll for yourself. You don't do that. You just take out withdrawals from your business account and then you report quarterly estimated taxes to the state. And then hopefully you don't pay a big tax bill at the end of the year, too, but sometimes you do. And what's really kind of rough about being a sole proprietor, and sole proprietor, by the way, is just the default term for anybody that does business as an individual. As soon as let's say you went over to your neighbor and said, "Hey, I'll paint your house for 200 bucks," and you shake hands, you're technically in that moment a sole proprietor. Granted, a lot of people probably won't report that income because it's probably cash, but I'm not saying to do that, but in that moment, you've technically on paper become a sole proprietor, and you actually have taken on a lot of liability for that too. Let's say you smash that window and it costs $600 to replace the window. Technically, you're supposed to replace that. Now you're negative $400. That's why a lot of people choose an LLC for much bigger problems than smashing a window. But an LLC actually allows you to create a limited liability company that protects you from some of that legal risk as an individual. Um, but both sole proprietor and LLC in the eyes of the IRS, right? Because you're actually kind of viewed by two different lenses, the eyes of the state, what you are as an entity, versus in the eyes of the IRS, which is how you are taxed. Both are taxed the same. They call it a disregarded entity. And all of your net income is hit with a 15.3% self-employment tax. And you're like, Mark, why the heck are you talking about this? Like, supposed to be talking about healthcare. And I'm like, I know. Just hang tight. I want to show you how S-Corp and healthcare and PEO all work together to not just drive tax savings, but also unlock group benefits. And also just maybe if you haven't kind of gotten into this too deep, give you a little bit of a high level overview of the kind of tax side of things. If you have more questions, we do have a S-Corp 101 webinar too. If you go to the top of the chat window, there's a link that says to our What is the S-Corp page. You can click on that and then scroll down to the bottom. There's a whole S-Corp 101 webinar too. But but at a high level, there's this self-employment tax, and the self-employment tax, it feels like a penalty, right? It's really nasty because I made $120,000, I had $20,000 of expenses. Boom, I get hit with so I have 100K of net income. I get hit with $15,300 of self-employment tax, and that's before my personal income tax comes into play, right? And that's what's actually happening there is those are the taxes that go to the things like Social Security, Medicare, Medicaid, all these social programs that are normally coming out of the employer and employee payroll on a biweekly basis, but the government is just figuring out how to recreate that tax now that you are effectively employee and employer. There we go. So the self-employment tax is not a penalty. It's just a reflection of what happens in normal business. It just feels really rough because most of the time the employer is covering half of it, and you don't have to cover half of it. So that's pretty tough. So the S Corp is really interesting because it kind of splits you into two people, I like to think, and you can have a conversation with yourself, you can fire yourself, it'd be pretty funny. But essentially you become the owner of this S Corp and then you are the employee of this S Corp. And I like to think of it this way, right? The IRS and the states love to get their money on more regular cadences, right? So when you become an employee of your own S-Corp, you have to run a traditional payroll and what's called a reasonable salary. And the state and the IRS loves this because now they get their money every 2 weeks or every quarter or whatever it is, versus, kind of this the sole proprietor and LLC scenario where you're just kind of on an honor system almost to pay on a quarterly basis. And a lot of people don't, and they get a fine at the end of the year. So basically the IRS is rewarding you for running this salary. So basically how it ends up working is the reasonable salary is typically roughly 40 to 60% of your net income. Whatever's left over, that comes to you as an owner's distribution of an S Corp. And that owner's distribution of the S Corp is not hit with the self-employment tax. So that's the big savings right there. Okay. So let's do that fun little fuzzy math again. Let's say you're making $120,000, you have $20,000 of expenses, right? And so now we have $100,000 of net income. And now let's say you're running a reasonable salary for yourself of $50,000. And I'm just throwing numbers out there. This is not kind of what actually ends up happening. Well, now you're only paying $7,500 of those social taxes on that payroll money. That other $50,000 comes back to you without that self-employment tax hit. So boom, that's $7,500 in savings right there. And that's how the math works at a high level. Um, Now, it does cost a little bit more to run an S Corp. Companies like ourselves, like Lettuce, has made it as economical as possible at $299 a month, so $3,600 a year. So you do have to factor that into when S Corp makes sense, because you should only do S Corp and take on the little bit of additional. There is, Lettuce makes it as easy as possible, but there is this a little bit of additional compliance that comes along with it. So you want to make sure that you're actually putting some money in your pocket, in that 80 to 100K range tends to be a really good spot where you're like, cool, by making this decision, I made $2,000 more this year, and that's great, or $3,000 more. People that are above the 150, 200 level can really rake in some extra dough, depending on where they set the reasonable salary. And of course, our team helps set the reasonable salary. But now let's talk about benefits again. Finally, Mark comes back around and talks about what's actually the webinar is about. Now, in an S Corp scenario, we have that payroll, right? Which a PEO, our PEO, can take over. And the way in which that happens is a contract called a client services agreement. So the client services agreement defines, hey, what we're doing, what you're doing, and now that payroll is there, and now we can group people together from different solo S Corps. So that's how the S Corp and the PEO are intertwined, is around that payroll. Now, the only strange thing that happens out of this whole scenario with PEO is that your paycheck says the PEO's name. In our case, that's Lettuce PEO 1 LLC, right? So the kind of W-2 version of yourself is now getting paychecks from the PEO. Once again, this happens all the time, right? There's probably millions upon millions of people in this country that are out of the 200,000 businesses that are on PEO today. So it's very normal. So here's a very high level of overview again, and I probably could have saved you 5 to 10 minutes of rambling if I just brought you this slide, but I think it's good to kind of understand the underpinnings here. So let's talk about how this works again at a very high level. Your S Corp, right, because it can only work with S Corp, utilizes a client services agreement to ask Lettuce, right, to take over as the payroll operating employer of the W-2 version of yourself that you have to have in an S Corp to justify the reasonable salary. We're just the payroll operating employer. You are still the admin employer, meaning you get to tell yourself what to do, what to work on, all of that stuff. And that's completely defined in the CSA. Lettuce PEO has no working control over you. It's more about kind of just taking over this administrative junk. And this relationship is called co-employment because technically you are hired under two companies, which is pretty interesting. There's also some really cool things that happen on the payroll side of things. It streamlines a bunch of the payroll operations that are a little bit more complex, and also streamlines a bunch of the compliance. And there will be other really cool perks we can add over time utilizing the power of that group because we've now taken a bunch of individual solos that kind of, I'll be honest, health carriers and insurance carriers don't really care about that much and turned it into a nice big chunk that they can actually talk to and they actually will negotiate with. So we kind of take on a little bit of this negotiation role as well as an economy of scale. So today we have healthcare. We'll talk about what our healthcare offering is. It's very cool. We spent a lot of time finding the right partner, and we're very excited with Curative. And as I mentioned, we have dental and vision coming soon. We have 401k now. We have a solo 401k offering that is becoming more and more integrated directly into the Lettuce platform through the company Carry that we purchased. And then we'll probably be adding either life or accident insurance that tend to be the most requested ones after dental and vision. So Curative is really interesting. Curative, the reason you haven't heard of Curative, because Curative is a new health insurance carrier that only works with employer groups. They do not sell to the individual marketplaces. They can have a lot more control and can actually keep themselves, employer groups tend to be a lot less risky than just trying to sell to the open marketplace plans because you never know what's going to happen out there and who's going to join. Curative gets to underwrite, right, the employer group and then say, okay, here's the risk level depending on this group, and here is your rate. What's really serendipitous that I forgot to mention a little bit earlier about this whole scenario is that solo S-Corps tend to be a very healthy population. And historically, we don't get rewarded for that because we're all kind of just thrown into the ACA marketplace pool. And a lot of, the running joke, if you talk to a lot of health carriers and all those types of folks, is they call it the insurance of last resort, right? So it's, part of what's happening here too that we really love is that we get to actually reward solopreneurs for being healthier. And I like to think that's because we have the time to, follow our passions, go after fitness, spend time with their family, decrease stress, etc. But sorry, I digress. Curative is an employer-only carrier. They're probably right around 200,000 lives at this point. They're one of the fastest growing carriers in the country. And they are $0 out-of-pocket costs for in-network care. Let me say that again. No out-of-pocket costs for in-network care. The only things, there's some medications that have copays and that kind of thing, but their whole thesis is let's eliminate the barriers to preventative care and in turn create a healthier population, right? What ends up happening a lot of times with high deductible plans and co-insurances and copays and all this stuff is a lot of people tend to avoid going to the doctor when they probably should, and then some of those situations spiral out of control into an emergency room visit, which is where costs go nuts, 30, $40,000 a day type stuff. And so what Curative is doing is going, hey, let's teach people through what's called a baseline visit. They actually want to meet with you 2 times, and that it's not a qualification visit. It's just basically teaching you how to utilize Curative and also understanding if there's anything happening in your life that you might need some assistance with from a health perspective. And let's empower people to stay on top of their care versus wait and then have to go to the emergency room, which then everybody has to cover those costs. And it's a huge national PPO network. We've been very happy with, over 1 million providers. And 24/7, 365 virtual care, $0 copay, fully included. It's great national PPO network. So if you're somebody that travels a lot too, so you go from California to New York, you can go see a specialist in New York because a lot of, excuse me, a lot of the marketplace plans are actually what is technically called a regional PPO, meaning they're actually, the craziest scenario, right, for me is like when somebody lives in New Jersey, and I talk to a lot of people in New Jersey and New York, and they want to go see a specialist in New York, and they didn't realize they were on a regional PPO, and the specialist in New York, who's 15 minutes away via subway, is out of network, which is wild, right? So with Curative, it's one PPO option, and if you're on the map, if they're on the provider map, they are in network. And the other really cool thing is you can actually nominate providers to add, which is very unique. Um, we have our benefits offering available in select states. This has nothing to do with where Curative operates. Has to do with where we can operate as a PEO. Okay. This is our operational limitations, not Curative's coverage limitations. Our PEO is technically Citrus or entities based in Georgia, but our plan is offered nationally because we're technically a Georgia employer and what's called a foreign qualified employer in all these states. But yeah, we're in 15 states now. Hopefully, we're going to add 3 to 5 more by the end of the year, and then add a whole swath of other ones in early 2027. So the premium rates, right? So let me just remind you, this is for $0 out-of-pocket coverage, right? So for in-network care. So yes, the premiums are not on the hyper budget side of things, but if you have to use it, the math starts getting a lot more compelling very early on, right? And there is, room for things like acupuncture and mental health and all that good stuff. So when we say employee and employee plus spouse here, because once again, we talked about the PEO, it's technically an employment relationship. Excuse me, I got a little bit of throat tickle today. Um, but that just means you as an individual is $696 a month, and you plus your spouse is 1670. You plus as many children as you have is 1253, and then the entire family is 2297. Typically, if you look at marketplace rates, this tends to be really compelling when you factor in that $0 out-of-pocket cost, $0 deductible. So will it work for me, right? You have to be a one owner, no employees. The PEO model gets far more complex whenever there's companies involved that have more than one employee, right? Because now all of a sudden, us as the PEO is kind of on the hook for some of those hiring and HR issues that are more like, workplace harassment, wage requirements, all that stuff. So part of the way in which we can give away PEO access, and I forgot to mention that the PEO services are included in the Lettuce Pro membership of $299 a month, is by simplifying it and saying, hey, you have to be a true business of one, which is our primary customer anyway. You can have as many contractors as you want. You can 1099 as many, you can have an army of 100 contractors, and that would be totally fine. It just gets the PEO piece gets complex when there's additional W-2 employees. And we also cannot support a spousal employee today. That's a question we get a lot. We're working on it because that scenario tends to be a little bit less risky, but we just don't offer it yet. You have to be a USA-based business in one of those states that I showed you before, the 15 states. And you can also go to lettuce.co/healthcare, and you can see which those states are again. And we also don't do the like digital nomad thing. You really have to be, because as the PEO, we have to know where you really reside. And so it tends to be really straightforward to be like, okay, do you actually work and reside in that state? Great. Because like if you're moving around and you're changing your residency every 3 months, it actually comes really complex for us as the PEO. And then the minimum income requirement, right? So, like at a bare minimum, 70K plus of gross revenue. We actually have a reasonable, you have to be running a reasonable salary for yourself of at least $40,000. So that really puts it closer to that like 70 to 80K of net income minimum, which is where S-Corp makes sense as well. So it's worth noting we don't sell health insurance as a standalone product, right? All of this is an extension of our Lettuce Pro S-Corp support, right? So it's, am I a good fit for S-Corp first? Yes or no, right? And usually that comes down to, am I going to net cash back in my pocket from the tax savings? If yes, great. Now we can add this PEO layer on top, but we cannot just sell you healthcare or create a shell company where you can access this. And people ask us that all the time because it's so hard out there. I get it. But we have a lot of responsibilities as a PEO to ensure things like minimum wage are being paid. So that's why we have that, kind of minimum requirement of a reasonable salary of $40,000 must be run. And typically that happens around 70 to 80 to 90K of gross or net income. So that is a lot of talking for me. Does anybody have any questions in the chat? Or I can actually, you might be able to raise your hand too or something, and I can then allow you to talk. But yeah, we'll give it a second here. Oh, here we go. If a provider is listed as cash card only, does that mean they are in network? Yeah, that actually does. So a lot of times I don't get into it on this particular webinar because it's a little bit tricky to explain, but it's actually a really cool mechanism. So there are two ways to pay for in-network care with Curative. There's the traditional, I've got my insurance card, you give it to the provider and they do all this billing behind the scenes, and Curative has negotiated rates and all this good stuff, and you don't have to do anything else. That's traditional system. That's like 50 to 60% of the providers. The Curative Cash Card is a really novel creation from Curative because they realized, hey, if somebody says, I would like to pay cash for a service, typically the rate of service drops in price 20 to 80%, right? So Curative was like, we're going to take this crazy scenario here and make it a feature, which is every Curative member gets a curative, think of it as a curative credit card. It's not something that you fund. You don't have to put money into it. It just means if you're going to a cash card provider, you're going to say, I would like to pay cash. And then you're going to hand your curative credit card. It's going to bill curative directly. And they're still going to deal with it all behind the scenes. But from the provider's perspective, they just receive cash, right? And so, you know, Curative saw a scenario where there's kind of this ridiculous thing happening with these crazy discounts based off of paying cash and turned it into a feature. And at this point, too, Curative knows, the schedule of rates for every provider in the country. There's been like two or three companies that have aggregated all that data. So they know, right, if it's a licensed provider providing reasonable schedule of rates, it's not a concierge at home doctor providing $5,000 an hour NAD infusions for longevity or something like that. So the cash card still, that's a very long-winded way of saying cash card is still an in-network provider. It's just a different way you want to pay. And that's part of the reason Curative wants to do that baseline visit too, is just make sure you understand exactly when to use the regular insurance card and when to use the cash card. The really cool thing about the cash card, as I kind of mentioned earlier too, is you can nominate a provider, right? Because as I mentioned, Curative already knows, hey, like we know this is a licensed provider within a reasonable schedule of rates, and this person's now asking for it. Great, let's add them. If you nominate a provider through the cash card network, typically 97% of them are added to the network within 2 to 15 business days, which is really cool. Um, so it's as long as, it's a normal doctor doing normal things, it's very likely that they will be added to the network. So even if you can't find a provider that you have, just know you have that avenue to nominate providers. And if it's a normal provider, it's most likely that it's going to be accepted. All right. Any other questions here? Not health insurance related. Are there transaction fees or transaction limits with the Lettuce bank account? Ooh, that's a really good question, Dave. And I am embarrassed to say that don't know. Oh, geez, sorry. Here we go. There's the benefit support. If you just reach out to support at Lettuce, don't send to benefit support. That one comes to my team. But if you just reach out to support at lettuce.co, I'm sure they can give you all the breakdown of fees. From my high level understanding, it's like very fee minimum. If there are any fees, they're incredibly light. Sorry about that, Dave. I should know the answer. Any other questions for anybody? Are there any health? Oh, Sarah, that's a great question. Right. No, there's no qualification questionnaire to join the PEO. Okay. Curative is a true employer group style plan. You basically just join the group and we're not going to ask, do you have high blood pressure or any of that stuff? It has nothing to do with that. The statistics are in our favor. S-Corp solopreneurs tend to be a very healthy population, and we should be able to reap the rewards of that. There are other plans out there that ask this pretty brutal questionnaire, and that's how they are deciding to limit who they cover, which was a non-starter for me. When I started creating this whole scenario with my buddy Jeff, we were like, no, like we have to be able to give coverage to people that need it, and it's not about just trimming who can join. It's about using economies of scale to drive better coverage with a better model. So it's a very long-winded way answer to say no, there's no pre-existing conditions questionnaire or anything like that. And the baseline visit that you do with Curative cannot disqualify you based off of whatever's going on in your health situation. Now, I will say that Curative tends to be pretty darn rigid around prescription drugs. That's the one place where I've seen people explore the prescription drugs they're on and realize that they have a pretty intense specialty brand name drug that they've fought for. And that's also where I've noticed a lot of if there is a bad review about Curative, it's when an employer moves a whole group, like 250 employees to Curative without talking to people and without, setting the expectation of like, hey, Curative's pretty rigid around generics on the prescription drug side of things. So that's definitely one place you want to be, you want to look into what drugs are supported. If you just go to curative.com/drugs, I wrote drugs. There we go. Um, you can take a look at prescription drugs. That's the only place where I really tell people make sure you're fully understanding that there are some limitations there. For 99% of scenarios, it's not that way, right? It's great. So if anybody wants to see the formulary too, which is a real kind of robust breakdown of prescription coverage, just email me at benefits-support and I'll send you all the plan docs and you can throw it into ChatGPT or whatever your favorite LLM and understand exactly what is covered. And most people are very pleasantly surprised. I just so I'm a licensed insurance producer. So my job here when we're talking one-on-one about care is to just try to make sure this is the best fit for you possible and be as transparent as possible. Okay. Any other last minute questions here? Oh, there we go. If Lettuce is only offering health insurance, would we then get vision and dental separately on the open marketplace? That is the option today, but we're hopefully going to be unveiling dental and vision here in the next month to 2 months. And the really cool thing about the offering we're giving is it won't have a waiting period. Most dental vision plans have a 12-month waiting period for everything except preventative care. So you can still go to the dentist to get a cleaning and that sort of thing. But for everything else, you're not allowed to use it for 12 months. Ours will not have that. But in the interim, you could get a dental vision plan through the marketplace. That's what our current enrolled members on healthcare do. And then once we are able to offer it, we kind of have this mini enrollment period where you can then switch again. Um, yeah, great. And you also, sorry, you could buy you could enroll in Lettuce Healthcare and just choose to get dental vision somewhere else too, if you wanted to. Like you have the option there to just enroll in healthcare. To date, we do not allow enrollment in just dental vision. You have to want to join the PEO for healthcare, and then you can add dental vision. That makes sense. Okay. Well, going once, going twice. Oh, there we go. There's Dave. All right, cool. No, it was great talking to everybody. Thanks for joining. If you have any more questions, just shoot us an email at benefits-support@lettuce.co if you want to talk about benefits, or just support@lettuce.co to talk about S-Corp. And yeah, I hope you all have a great week and hope the summer's going well, and we'll look forward to connecting soon. Take care.